Fetal circulation is a specialized circulatory system that provides oxygen and nutrients to the developing fetus while bypassing the non-functioning lungs. This system is distinct from postnatal circulation, relying on the placenta for gas exchange, nutrient delivery, and waste removal. The placenta acts as the primary site for gas exchange and nutrient delivery. Oxygenated blood from the mother's circulation enters the placenta, where it is transferred to the fetal circulation. The placenta also facilitates the removal of waste products from the fetal blood, which are then excreted by the mother's kidneys. Oxygen-rich blood from the placenta is carried to the fetus via a single umbilical vein. This vein carries oxygenated blood towards the fetal heart. The umbilical vein enters the fetal abdomen, and most of the blood bypasses the liver via the ductus venosus, a vessel that shunts blood directly into the inferior vena cava, IVC. A smaller portion of blood does pass through the fetal liver. The blood from the ductus venosus mixes with deoxygenated blood from the lower body of the fetus in the IVC and flows towards the right atrium of the heart. Upon reaching the right atrium, fetal circulation involves unique shunts that allow blood to bypass the non-functioning lungs. Most of the oxygenated blood in the right atrium flows directly into the left atrium through the foramen ovale, a small opening between the right and left atria. This allows blood to bypass the right ventricle and pulmonary circulation. The blood that does enter the right ventricle is pumped into the pulmonary artery. However, since the lungs are not used for oxygen exchange, most of this blood is diverted away from the lungs via the ductus arteriosus. The ductus arteriosus is a vessel that connects the pulmonary artery to the descending aorta, allowing most of the blood from the right ventricle to bypass the lungs and flow directly into the systemic circulation. Blood that enters the left atrium via the foramen ovale is then pumped into the left ventricle and from there into the ascending aorta, which supplies oxygenated blood to the head, neck, and upper limbs. The most oxygen-rich blood is delivered to the brain and upper body, which is critical for the development of these vital organs. After supplying the upper body, the mixed oxygenated and deoxygenated blood flows through the descending aorta, supplying the lower body and returning to the placenta through the umbilical arteries. The umbilical arteries, which are branches of the fetal internal iliac arteries, carry deoxygenated blood back to the placenta for reoxygenation and removal of waste products. At birth, when the newborn begins to breathe, the pressure in the left atrium increases, causing the foramen ovale to close, forming the fossa ovalis. The ductus arteriosus constricts and eventually closes, becoming the ligamentum arteriosum, redirecting blood from the right ventricle to the lungs. The ductus venosus also closes, becoming the ligamentum venosum, and blood from the portal vein flows through the liver before entering the IVC. Finally, the umbilical vein becomes the ligamentum teres of the liver, and the umbilical arteries become the medial umbilical ligaments. Fetal circulation is designed to efficiently deliver oxygen and nutrients to the developing fetus while bypassing the non-functioning fetal lungs. It involves specialized structures like the foramen ovale, ductus arteriosus, and ductus venosus that shunt blood to optimize oxygen delivery. At birth, these shunts close, and the circulatory system transitions to the postnatal pattern, where the lungs oxygenate the blood.